Dean Giles. Thank you for the invitation, and good afternoon, everybody. So I am going to talk to you about fiscal policies for health. And I've learned from the others it's 4 clicks. So actually, no, it's only 3 clicks. So the idea here is essentially that taxes will be used in order to help reduce the consumption of products such as tobacco, alcohol, and sugary beverages because of the fact that these products are associated with diseases that we know of, right? So lung cancer, cirrhosis of the liver, diabetes, obesity, and in turn, these have associated costs. They have costs that are medical, they reduce productivity, they have social costs. So what, from the economist's point of view, we want to do is set the tax equal to these external costs in order to reduce demand, because the cost that you see when you purchase these goods is not embedded in the price. Once we're able to do that, demand would fall and then health would improve. So you say to yourself, well, this seems like a no-brainer, right? And we know we have a lot of tobacco taxes we're familiar with, alcohol taxes. Sugary beverage taxes, though, are more new, right? So they're newer. So why don't we see more of them? I'm going to give you an example. So do these work? You may remember a few years ago, we had a tax in Cook County, and it was repealed. So did it work? So here's some data where we had UPC code level data from supermarkets and a whole host of other stores right across Cook County, and a comparison site in St. Louis. And we were able to take this data, and we had it weekly over thousands of products and model it and look at this counterfactual where there wasn't a tax. And you can see that when that tax came in, sales fell by a substantial amount, right? So over a quarter of the sales fell. Sustained. The tax was repealed, which was terrible from a public health point of view. For a researcher, it was a nice sort of interruption in our design, I will admit. And then you can see that sales went right back up. So this was a pure price effect. We actually didn't learn anything. The fact that the tax was in place didn't really send a signal, but it was also not publicized as a public health measure, if you remember back to when it was announced. So, as I said, why do we know that they work? Evidence from tobacco, a whole host of that shows significant reductions in consumption and smoking and initiation, particularly among youth. Why don't they work? Well, industry, as we know, right, has a vested interest in not having these taxes because it's going to reduce the demand for their products, which we just showed. So one claim that's used, and there's many, but I'm going to give you just one example, is that there's going to be job loss. So we have also modeled this. We've used data from the Bureau of Labor Statistics. We did this for 2 taxes, one that was in Philadelphia and one that was in San Francisco, and we were able to show there was no change in employment. Well, why is that? Because if you don't spend your dollar on a sugary beverage, you will spend it somewhere else. So that money does not disappear from the economy. So researchers need to provide evidence on what are the intended impacts, reduced demand, but also unintended impacts. And maybe we can work collectively to maybe see a tax at the state level, and maybe it could be Illinois could be the first one. Thank you.